Hi, I'm Vanessa Mantilia, a physical therapy intern from RTR Medical Foundation in Tacloban City. Today, we're going to be talking about 3 outcomes measure used for individual with low back pain. Back pain is a vast topic to discuss as it shows its impact on a patient's physical, emotional, and social quality of life. Furthermore, treating back pain involves considering the biopsychosocial model into aspect. Besides treating back pain, there is a need for using appropriate and suitable outcomes measure in clinical practice. These outcomes measure must be used based on the needs of the patients, their severity of symptoms, and their clinical presentations. So for today, we're going to be talking about the Brief Pain Inventory Questionnaire, the Back Pain Functional Scale, and the Roland-Morris Disability Questionnaire. First off is the Brief Pain Inventory Questionnaire. The BPIQ is a 9-item self-administered questionnaire used to evaluate the severity of a patient's pain and the impact of this pain on the patient's daily functioning. The patient is asked to rate their worst, least, average, and current pain intensity, list current treatments and their perceived effectiveness, and rate the degree that pain interferes with general activity, mood, walking ability, normal work, relations with other persons, sleep, and enjoyment of life on a 10-point scale. Now, who are the intended population? Originally, these outcomes measure is intended for use in epidemiological studies and clinical trials involving patients with cancer-related pain. But now, this is widely used in a range of chronic cancer-related and non-malignant pain conditions, including HIV, phantom limb pain, critical limb ischemia, neuropathy, low back pain, and osteoarthritis. This has also been used to assess individuals experiencing acute pain, for example, post-operatively. Now for the method of use. The questionnaire can be completed via self-report or interview. The short-form version takes 5 minutes for the patient to complete. Here's an example of the Brief Pain Inventory Questionnaire. Now let's move on to the second outcomes measure, the Back Pain Functional Scale. The Back Pain Functional Scale is a subjective scale used to measure the patient's physical function after low back pain. It is simple and easy to understand and administer by the patients. This scale is based upon the International Classification of Function or ICF model. This scale consists of a total score of 60. Moreover, the patient's score can be measured from the responses obtained on the Likert scale numbered from 0 to 5, and accordingly, a total score is summed up out of 60. The BPFS consists of the following 12 items. Now for the scoring. This BPFS uses a Likert scale of 0, meaning the patient is unable to perform the activity, and a scale of 5, meaning the patient has no difficulty performing the activity. Now for the last part, the Roland-Morris Disability Questionnaire. The Roland-Morris Questionnaire is a self-administered disability measure in which greater levels of disability are reflected by higher numbers on a 24-point scale. The RMQ has been shown to yield reliable measurements which are valid for inferring the level of disability. Now for its scoring. The patient is instructed to put a mark next to each appropriate statement. Add up the total number of marked statements to get a patient's score. Here's an example of the Roland-Morris Low Back Pain and Disability Questionnaire. That's the end of my presentation. Thank you for listening.